Hello, folks. Welcome once again to Mental Health Matters on WPVM 1037, the voice of Asheville. This is Todd Weatherly, your host, mental health professional and therapeutic consultant. And I'm here today all on my own. Going to give a little bit of a monologue about some things I think are important for people to understand. Had a couple of guests that had emergencies they had to attend to, people who had mental health challenges that they needed to support. And I've certainly been in that category myself. You have things going on, and all of a sudden you have to drop everything because somebody is in crisis, which is kind of part of the work that we do. Um, and so, one of the things that I'd like to talk about, because I think it's out there and people don't understand it, and it starts to impact your life in ways that are not clear in the beginning. Either the person who suffers from this condition or begins to suffer from this condition, or a person who is in a relationship with someone who suffers from this condition, and the condition is borderline personality disorder. Um, it's tricky. It's hard to treat. It's stubborn, and not unlike disorders that come with, not unlike thought disorders. People who suffer from borderline personality disorder often are not really aware that they are suffering. They're not cognizant. They're not what we call insightful about their condition. They lack insight about their condition. And so I'll pick a line off the National Mental Health Institute. Borderline personality disorder is a mental illness that severely impacts a person's ability to manage their emotions. The loss of emotional control can increase impulsivity, affect how a person feels about themselves, and negatively impact their relationships with others. Effective treatments are available that can help people manage the symptoms of borderline personality disorder, but getting them into treatment, and this is mine, not the National Mental Health Institute's, getting them into treatment can be challenging. Um, and a lot of times, if a person suffers from a condition that is bad enough that it would meet diagnostic criteria, that means that if they went and got assessed, and think of diagnosis in mental illness. The DSM-5 now the Diagnostic Statistical Manual for Mental Disorders. Think of diagnosis in levels. So for example, you may have symptoms of depression, but they're mild, they are manageable, they don't negatively impact your life. That is, you can show up to work and you can do all the regular things, and no one would know if you didn't tell them. And so that would be, while you may suffer from symptoms of depression, you don't suffer from clinically significant symptoms enough to warrant a diagnosis of minor or major depression, for example. So if you suffer from depression that is debilitating, then you suffer from depression that is clinically significant and at levels high enough to warrant a diagnosis of severe clinical depression. So, and even there are levels. There are people who are debilitated by severe clinical depression, and suffer from that terrible disease, and it is very difficult to overcome. But even there are even levels there. There are people who suffer from depression that is so bad that they suffer from psychosis at the depths of it. So it can get really nasty, honestly. And so borderline personality disorder, and whenever you think about disorders, typically a person who suffers from anything that is clinically significant probably suffers from co-occurring conditions. So depression and anxiety tend to run hand in hand. If you suffer from borderline personality disorder, the chances are very good you suffer from pretty significant anxiety on a regular basis, and at times pretty significant depression at times, and they both impact your life. That's chances are really good that if you run around with one of those diagnoses, you're running around with a couple more. We call that co-occurring conditions. So for a person who suffers from borderline personality disorder, the issue becomes, and before I even come to the issues of borderline personality disorder, I got to this was several years ago, and you find a lot of mental illness kind of stems from this, but it stems from trauma. It stems from, and if you think about it this way, um, The doctor I got to see, and I wish I remembered his name, but it was many years ago when I was young in the profession, and he was talking about how borderline personality disorder, otherwise known as BPD, is an inappropriate diagnosis. He said it's advanced PTSD, so advanced post traumatic stress disorder. And he gave it this explanation, which I thought was really good. Um, if you are, let's take the quote unquote normal human being that's running around there out there in the world and is able to maintain their life and do the things. Okay. So, but everybody has ups and downs. All of us, we all have ups and downs. So there's this natural cycle of kind of ups and downs, and it looks like a wave, what you would see in a radio wavelength. Like it looks like a wave. There are peaks, there are valleys, and there's a baseline that kind of the peaks don't rise more than X amount over the baseline, and the valleys don't go but X amount below the baseline. But then this individual, some point in time in their life, they encounter an event, something that is traumatizing. Maybe it was a car accident. Maybe it was the death of a spouse. Maybe it was, who knows what it was. There are, unfortunately, too many terrible, horrible stories, including rape and sexual assault and spousal abuse and child abuse and all these things that are a world of traumatizing event out there for people to endure and experience. I wish it was not that way, but it clearly is. And so this person experiences this event and they survive it. Now, let's take a car accident just to be on the safe side. Not talk about something that we re-traumatizing for other individuals. If you, we most of the people who are listening to the show probably been in a car accident of some level. Hopefully not too bad. But when you get in a car accident, you're going to experience all the things that a person experiences when they encounter trauma, which is all of a sudden your car's been hit or you hit another car, and you have to be off the side of the road, but your system gets activated really high. You know, your emotions and your brain and all parts of you are kind of running in the red. You might feel overwhelmed. Your brain's just kind of going in a million direction. You can't contain your thought. All you can think is pull over, whatever. And maybe check on the other person. You've got people that they have all kinds of interesting scenarios that happen when a car accident happens. So, but the point being is that suddenly you have spiked your system over and above any of its level baselines, over and above anything that it's experienced before. So, as opposed to the regular highs and lows, in this case, a high when you have the accident, because it's very, you go into fight or flight mode. So when you experience the high, it goes over what you've experienced, any experience you've had in the past, and now you've set a new watermark, if you will. You ever been to a bridge and they've got all those numbers on the side of the bridge, and one of them, sometimes you'll see lines or you'll see stains where the water has actually risen. Now, usually, um, they have a common area where they rise and fall, and they don't rise above a certain mark unless you get a flood. And that's what they call, when you've had some of these experience and you've been kind of emotionally jacked, everything's on fire. They call it flooding, actually. So, person gets flooded and it goes way above the mark, way above it. So now there's a new watermark on this register here. And one time is not necessarily going to throw you too far off, but more than one time or repeated kinds of things will start to reestablish the mark. And the thing about the system is that it accommodates the mark. So however high you went, the system will turn around and go that much lower to offset. Okay. So now we've got a new high and low mark. Ever so if you've been in a car accident, you probably have, and you got flooded and you handled it, maybe the police came and tickets were written or information was exchanged and so on and so forth. And you got in your car and you started to drive home and you just felt really, really terrible. You felt really low. You felt really sad. You felt really worried. You felt awful. But it was not the same kind of awful when the accident happened. It was the low version. So you crank the system into high. Um, it has to offset that experience by going to low. So it's a counterbalance, if you will. The emotional system does this so it can bring you back down. So, however, and especially if there's repeated incidents of this kind, you've set two new marks that are well above and well below the regular everyday highs and lows that you used to have. At some point, the system starts to determine that it needs to accommodate this new high and low. If normal was, a basic high and a basic low before, and now you've established two new marks. Now it's going to set your highs and lows, not for the top, mind you, but somewhere in the calculated average of the two new highs and lows, and your high and low will increase. High will increase. That is the level of anxiety, the little level of flooding that you experience on a regular basis will increase slightly, as will the low, because remember, it's a counterbalance because you've set new marks. Now, if you set new marks and this system starts to recalibrate in this way, unfortunately, the opportunity to encounter new events it becomes higher because your activation is regularly higher. Um, it take me a while to explain that, but think of it this way: if you've got a person that maybe it's a family member, maybe it's a person at work, maybe it's whoever it is, somebody in your daily life, or maybe not in daily life, but you encounter them enough that it's a regular thing. If you've got a person who you don't get along with, and every time you come together with them, you get in some kind of argument, the likelihood of you getting in an argument with them the next time you encounter them is pretty high. Okay. So, in your psyche, if you cultivate this recalibration, the thing that you have, the thing that it revolves around, let's say it's car accident, let's say it's driving a vehicle. Every time you get in a vehicle, you feel a little on edge. And as a result of feeling on edge, your decision making is impaired. Because when you're activated, if you're a person who is emotionally dysregulated, emotional dysregulation, that's a clinical term. That means that you're upset. And everybody knows that when you're upset, you don't think very well. Judgment's not very good. You're not clear headed. It's not the place from which you want to make decisions, especially not big ones. You don't want to start making, life decisions when you're upset, period. End of story. Try to get as level headed as you possibly can and make as objective a decision about something that's life altering as you possibly can. And there are all kinds of scenarios that applies to, but the truth is that if we go to this, we're talking about again borderline personality disorder. We've got a person who is experienced an event, um, and it's traumatic to them. And as a result of experiencing the event, they've recalibrated their system, they've established new marks, and every time, let's go back to the car. Every time they get back in the car, they're anxious and they're on edge and they have a hard time concentrating on where they're going and what they're doing. And so what you do is you increase the likelihood that you're going to encounter that event again. I'll give you another example, and it's unfortunate, and it's so difficult, and it happens mostly to women, but it also happens to men. But you're talking about abusive relationships where one partner gets into or one individual gets into relationships with partners who are abusive, who engage in physical altercations with their partners as a medium of their relationship. And for a person who's been in those kinds of relationship, the likelihood of them getting in another one is very high until they address the trauma that started the whole thing, maybe get some help, do some therapy. EMDR is a really excellent therapy for this. Neurofeedback's an excellent therapy for this, but seeing someone who knows how to work with you around trauma is important. Um, and if you can reconcile it, you can work on calming the nervous system and not engaging in patterns of behavior that would cause you to repeat whatever traumatic event there was, whether it was a car accident or it's a bad partner or bad relationship or something else. So that's the person who has been, so I like to call it hijacked. You know, you've been hijacked by your emotional machinery. You've been hijacked. You've been flooded because you've experienced an event. You've got new highs and lows, and as a result, the emotional system is recalibrated. So, as a result of recalibrating, you now also increase the likelihood that you're going to encounter those events again, and that's what happens. So, a person who suffers from borderline personality disorder hasn't just encountered one event. Usually, they've encountered many, unless it's really, really traumatic, like sexual trauma, sexual abuse, those kinds of things. Very traumatic. Doesn't take more than one event to really throw a person's life off. Um, but point being is that their highs and lows have recalibrated the system. They, they look at the world, they experience a ton of anxiety, they experience a ton of depression and all kinds of other, emotional and cognitive and mental symptoms that come along with having experienced trauma and then going in the world and having to kind of try and operate again. Now, with borderline personality disorder, there's the the deaf have or excuse me, the deaf have a sign. They have a sign for borderline personality disorder, and it's one hand's waving forward, and the other hand's waving backward. And come here, go away. Come here, go away. Come here, go away. Because um, you've got an individual who has experienced trauma, usually in like in the context of relationship. And even if the trauma is not in the context of relationship, anxiety doesn't just go away when you get out of the car, right? Like you have anxiety, and now anxiety you start to have anxiety about all kinds of things, and you're on edge. And people on edge are difficult to have a relationship with. It's just true. And then it's a little like, this kind of stuff, and I hate to use this analogy, but it's a little like a cancer. It's a little like, once you have something that impacts you in one area of your life, and you have anxiety and you have trauma and you have, these emotional dysregulation kinds of symptoms, they start to leak over into all the other aspects of your life. They leak over into your relationships. They leak over into your job. They leak over into your life, your whole life. And so, a person who's very highly anxious and spends a lot of time experiencing depression, that person were, say, married to someone who's very kind and generous and did all the right things, they're going to come back into the home and they're going to carry this anxiety and this depression and everything else, and it's going to be very difficult for them, and they're going to want to isolate, and they're going to want to just shut people out, and if anybody tries to come and support them, they might, push them away because it's too uncomfortable to have to deal with the pain that they're grappling with inside. Um, and then that becomes a pattern in and of itself. And you know, they want someone to give them the attention because we're human beings and we want attention from other human beings. We're social in nature, and that's how we are. It's not a bad thing. Um, but then the moment that an interaction starts to happen with another individual around that they have a relationship with, it becomes too much. The anxiety is too high, and they can't take it, and they have to go, please go away. And so, as a result of that, relationships start to fall apart. People can't handle being the friends with this person. They can't handle being married to this person. They can't handle the stuff. And then this person gets into this is when you start to get into the stuff that is life debilitating. They can't keep a job. They can't maintain relationships. The relationships are volatile in nature, and maybe not necessarily physical, but there's a lot of arguing, and there's a lot of blow ups, and there's a lot of intensity, and then they don't last. And so When that starts happening across all the basic thresholds of your life, from, you know, your ability to go out in the world, your ability to maintain relationships with family or with partners, children, you name it. It becomes hard to even go out in the world and go to the store and get groceries. There's so many things, and then that person begins to isolate and can succumb to depression, pretty severe depression. And so, like I say, borderline personality disorder always comes with aspects of anxiety and depression. I haven't known a case that doesn't yet. Um, and they can be very difficult people to even want to help because you know, you've seen Karen videos. I put money on a number of, if you see a person who's turned into a Karen inside of a store or something like that, and we have this expression now, Karens. I think the other one's Kevin's, right? Women aren't the only one. Men are just as guilty of borderline personality disorder and or disorder. You'll find men kind of way over into narcissism a little quicker. But if we were to do a study, I don't have figures for this in today's world. Several years ago, they were going to try to get rid of narcissistic personality disorder because it was so common, it was now normal. I don't think that's a good idea, personally. At any rate, point being is that, you know, these people are challenging to deal with. They come in and they're never wrong and they're never accountable for anything, and everybody else has done something to victimize them. That's that stuff. And they sound completely crazy. They sound unreasonable, and you can't there's no logic that fits. There's no getting a word in edgewise. There's no trying to reconcile. There's no trying to find a way to have dialogue. Like, it's all just an explosion. And it feels crazy and it feels dysregulated. And if you think that you're a person who's dealing with someone who's rational and reasonable when you encounter this, the first question you ask yourself, I think, and the first indicator that you might be dealing with someone who suffers from borderline personality disorder is, am I crazy? What did I do something? What did I do to make this happen like this? You know, the gaslighting and all the other stuff that comes along with this behavior. And so, there's a few good books out there that you can read about borderline personality disorder, diagnostic or otherwise. One's Walking on Eggshells. I think the title of the book says it all. But if you're in a relationship with a person that is suffers from borderline personality disorder, the first thing they need to do before you start deciding whether or not you want to maintain the continuity of your relationship, of say a marriage, for example, is for that person to get help. Couples, partner, marital therapy, that's not where you start with that. Unfortunately, you have to start with that person getting their own help and identifying the place where a kind of original trauma exists. But um, I think it's important at this point in time, we're talking about, you know, borderline personality disorder. Borderline personality disorder, when it gets bad enough, can turn into bipolar disorder, where the person's highs and lows are so high, and that when they get dysregulated, they become, actually, there's thought disorder. There's like delusion and thought disorder. Um, and you've got people who've experienced extreme trauma that, as a result, end up later in life. And I'm also skimming past a lot of the neurological stuff that goes on here, because the brain is definitely involved, and there's a lot of chemistry that's there, which is why medications can be very, very helpful. But you got people who suffer from psychosis, schizoaffective disorder, schizophrenia, as a result of extreme trauma. I mean, this is a wide and broad territory, but a lot of it rooted in trauma, a lot of it rooted in severe and persistent kinds of trauma, not just traumatic events that have happened once, but traumatic events that have happened repeatedly over a period of time for people, unfortunately. And so, one of the things that you need to know about trauma, that is something that the field, we started off in a place where we used to think that trauma was a thing that you kind of jump into it, and You go immediately after the trauma and you try to find the source event and you resolve it. You do therapy around it and everything else. And that is no longer the prevailing thought about how to work with trauma. Not that identifying original traumatic events or is necessarily not part of the work. It can be, certainly can be. But you go in, and I call it the trauma trunk. You go in and you dig through, you open the trauma trunk, and you dig through it, and you throw things out, and there's stuff all over the floor. What you can do is re-traumatize a person who is remembering a traumatic event. There's also people who work with people who suffer from severe trauma, who suffer from vicarious trauma, which is being traumatized while a person is re-encountering their traumatic event and telling you the story. Um, and there's also putting that stuff back. If you're talking about a pretty severe traumatic event, and then somebody kind of goes back and remembers it, putting that stuff back is hard. It's really hard. Um, and so the person can be re-traumatized. They can be so dysregulated as a result of having to remember that stuff that their week is ruined, their day is certainly ruined. And they can even, they start if they've reached a baseline, if they've reached a place where they're doing okay again, and then you open that trauma trunk and you open that event again, you may dysregulate them and cause them to go into a depressive episode. I mean, you got to be really careful. You need to be, if you're working with therapeutic professionals and you've got something that you think or you've been told is a pretty severe uh, condition, emotional condition, and trauma is at the source of it, you need to work with somebody who knows what the heck they're doing. And not all therapists do. So there are all kinds of therapists and there are all kinds of specialists. Find somebody who knows what they're doing around trauma and has got a lot of experience working with it and can help you with it. But one of the things that you want to do when you suffer from that level of trauma is you want to go after symptomology first. Is you want to make sure you've got skills and tools to be able to, self-soothe, regulate your emotions, um, deal with anxiety when it shows up, deal with depression when it shows up. There's cognitive behavioral therapy. A part of cognitive behavioral therapy is also dialectical behavioral therapy, otherwise known as DBT. People have heard of DBT before, and DBT is a set of skills that you learn that help you deal with symptoms, anxiety, depression, the experience of flooding when you encounter something that reminds you of the traumatic event. If you get flooded every time you get in that car, you got to figure out a way to deal with that. People suffer from panic attacks, but there are people who used to regularly suffer from panic attacks, and as a result of doing some work and learning some skills and everything else, they can feel it when it's coming on, and they engage in the strategies they have for preventing it from overtaking them. They breathe. They have things they say in their head. They have tools and skills that they're using, and they prevent themselves from experiencing another panic attack. So panic attacks are real, man. They are hard to deal with. They are they are rooted ultimately a lot of times in trauma, and not always just a specific event. But if you had a period of time in your life when you were a child that was hard, family moved, parents divorced, things were hard, stuff like that. Like there's that stuff. Um, uh, uh, Vanderkolk is the name of the author that has got a pretty popular book out. The Body Keeps the Score. It talks about trauma and how it leaves a mark. That it's there. It's not just in your brain's memory. It's in your body's memory. It's a somatic thing. Like there's a part of your chest that hurts, or if you had an accident, or there's something that happened, you carry your trauma in your body, not just in your mind, not just in your memory, but in your body. So there's a methodology called somatic experiencing where you go to the place in your body where you feel this pain or this heartache or this emotional flooding, and you work through it. You find the place in the body where it lives, You go there and you work through it. Those are methodologies and techniques that are used in therapy that can be very effective for treating trauma, anxiety, depression, borderline personality disorder, and these conditions that cause it that can be very debilitating for a person's life. So, if you are a person who is suffering from this condition and you are aware of it, there are people who get so far along in the condition that they're not no longer aware of it, and they usually get into trouble, or they have friends that tell them, or sometimes they don't get help at all. Sometimes they just get so bad off and they become so debilitated and they can't get help and they're not aware that there's a problem, and they just go through life that way. It sounds like a terrible way to have to go through life. But if you become aware of it, or friends are walking around, I'll tell you, somebody who does a very eloquent job of talking about it is Taylor Tomlinson, who's got a new special. She's got three specials out on Netflix. Her second special she comes out is bipolar. Her last special, she talks a lot about, the emotional regulation game she has to play. And I mean, it's funny and it's brilliant, but it's also eloquent. For a person who suffers from bipolar disorder or borderline personality disorder that's received care, you'll listen to Taylor, and I think that you'll feel very validated. And I think the other thing that I would say about all this is that you should not feel ashamed by this. You have this stuff that's going on. Um, and it is difficult to deal with. It's challenging. And for a person to be like, "Yep, I'm going to go deal with this. I'm going to go learn how to manage this stuff that shows up for me as a result of things that happened in my past and in my life." It's it's one of the bravest things that a person can do. It's terrifying to go in and say, "Hey, I'm going to dig through my psyche and figure out how to live again and figure out how to deal with the things that terrify me." I mean, it's not for the faint of heart. And for any person who engages in that process, my hat is off to you, because it is difficult, and it is something that requires incredible bravery, incredible courage to go and do. Um, it's worth it. It's worth it. But I do not envy a person their process when they have to endure starting that process and starting that journey of healing unresolved trauma. It's uh, it's a difficult thing to do, but if you are a person who can identify some of this stuff, I mean, it doesn't have to be, the people that I deal with in my work, the clients that I have are typically they're in crisis. Stuff has happened. It's gotten really bad, and they need residential treatment. By and large, most of the folks that I deal with are in that position. Um, but you've got a whole world of people that's running around there with this kind of emotional content, um, where they're able to maintain a regular life and they're able to do these things, but it's impacting them in subtle ways the average outside person may not understand. So your quality of life is being impacted, and if you go get help to address some of this quality of life, this emotional quality of life stuff, then you're going to engage in a process that you find enlivening. It's going to and restorative, and it's worth doing. Especially if you're a person who's kind of already got, you've got it together, but you really want to go and address this stuff. Like, do that stuff before it gets worse. If it feels like something that's kind of creeping up on you, do it early. Do it when you can. Especially, and I'll say this: if you encounter, like, you're older and your mother or father or a close family relative has just died and they were important to you, and those kinds of things, go get grief therapy. You had a a serious accident. First of all, go get some body work. But you had a car accident. Go get some body work, and go get someone to do a session of EMDR. You know, dig that stuff out while it's fresh, and just like, look, you think of EMDR as a methodology that helps you. You've got a part of the brain called the limbic system, It's the controller of all your kind of your rapid response emotional receipt, the machinery, your flight or fight responses. You have this mechanism in the brain called the amygdala, and it's not just for quick responses. It does store memory, so it'll store information about the accident, about the traumatic event. That stuff gets stored there. And one of the practices that you can do involving working around trauma is taking it out of the regular responsive emotional machinery and moving that event into long-term memory, where it's not always every time you walk out into the world, this traumatic event is sitting there telling you how to behave because the trauma might occur again. You're in danger. Run, your fight or flight system is getting jacked. They call it hijacking. Um, and if you can take that event out of that part of the brain and move it into long-term memory, it's events happen. They're not going to go away. But you can move them into long-term memory where they don't have to be part of your emotional machinery anymore. Where they're not impacting every decision that you make anymore. That work can be done. It can do it, and it's relieving when you do it. You're like, oh wow, these symptoms abate. Medications can help, especially if it's pretty serious. If you got stuff that's, you use medications for a little while until you can do some of the therapeutic work. And part of the way, especially for a person who, is not in that kind of crisis stage, medications are very important at that point. But, if you use medications as a medium by which medications are designed basically to abate symptoms. So you have anxiety, but you don't feel it as strongly. And so, if you can use medications as a way to address content that was traumatic, but not have the same level of reaction, the anxiety is not as high. The even when you're remembering the event, the anxiety and the depression or whatever is not as high. The flooding's not as bad because you're on a medication. You can actually get in there and do some work with it because you're regulated. And as you do some work with it, you can start to work your way off of the medication. Now, please do that with the assistance of professionals. Please do that in concert with a therapist who knows what they're doing and a psychiatrist who knows what they are doing, so that you can go in and do the work effectively and over time. There are many medications out there you should not just go off of. Please do this with the assistance of a psychiatrist and someone who knows what the ramifications of both going on and coming off of a medication are. So use these professionals. They're worth their weight in gold when they're good at what they do, and they can help you through hard times and help you live, a more fulfilling life, one that's not invaded by trauma or invaded by this flooding and, this regular upset of your daily life. So, I got some folks that are going through a lot of this stuff right now, and I thought it was important for me to address. If you want any more information, you can always reach out. But a lot of the folks I bring onto the show, we talk about this a lot, and I think it's important for you to know. Get help, be informed, have a great week and weekend. You folks enjoy yourselves, and we'll see you next time. This has been Todd Weatherly on WPVM 1037, the voice of Asheville. Uh, have a good one.